So in this lecture we are going to read about child abuse. Okay, so the most common form of child abuse is physical abuse. Okay, physical abuse is the most common. Then of this 50% occurs on the head and neck region. Head and neck region. Okay, and of this also more than 50% occurs near the oral cavity. Okay, so now we are going to read about two important syndromes which can come under the child abuse. So first one is battered child syndrome. Okay, battered child syndrome. So what happens in this? There is a history of injury which is not correlated with the signs and symptoms. Okay, so there is a history of injury but it is not correlating with the signs and symptoms which we see in the child. Okay, so this is the battered child syndrome. It was given by Henry Kemp. Now the injury over here is inflicted. Okay, so the injuries are inflicted and they are not accidental. Okay, so the injuries have been inflicted, they are not accidental, they have not occurred on their own. So this is known as the battered child syndrome. Now the second one is Munchausen syndrome by proxy. Okay, so this is another syndrome. These are important questions which have been asked in the previous years. Okay, so what happens in this? Most difficult form of child abuse. Most difficult form of child abuse to identify. So Munchausen syndrome by proxy is the most difficult form of child abuse to identify. Okay, there is repeated hospitalization. Okay, repeated hospitalization of the child is there. Repeated hospitalization of child without any disease. Okay, so there is repeated hospitalization of child without any disease because of the mother's psychosis. Okay, so there is repeated hospitalization of the child because of mother's psychosis. Then this syndrome is also known as pediatric condition falsification. Okay, so Munchausen syndrome by proxy is also known as pediatric condition falsification. in medical setup. And WHO, World Health Organization, has given the term factitious disorder. Factitious disorder.